Rhinitis is a very broad term which describes inflammation in the nose, and there are many causes. So people are aware of what we term allergic rhinitis, and this is all stimulated by an allergy to something. Most commonly, it's things like hay fever, so allergies to grass or tree pollen, and that's very seasonal, and patients will note when the time of the year that they suffer is. But it can also be other things like dust, which affects people all year round. And it doesn't matter how clean and tidy you are, you can't get rid of dust completely. Uh, Pet allergies is also common, and also a mold. So if someone does have a mold problem in their house and they have a mold allergy, then they will be quite irritated by that. People also ask me about allergies to foods. Now, it's far less common for food allergies to cause nasal inflammation. It definitely exists, and some patients will say to me that they eat or drink something particular and their nose swells up. Commonly, that can happen with alcohol. But for the vast majority of people, the allergy is caused by things that they can breathe in. So that's the allergic side of it, and we manage it with a combination of nasal steroid sprays and antihistamines and nasal rinses. The other group, the non-allergic rhinitis, is actually much more difficult to define, and it's very varied. For many patients, we can't actually work out the cause. And I often say to patients, it's a little bit like asthma. Asthma is inflammation of the lining of the lungs. Rhinitis is inflammation of the lining of the nose. It can be allergic and non-allergic, and often in the non-allergic ones, we don't know why, but certainly many people are very sensitive in the nose, and pollution is a big factor. So living in somewhere like London or any big city is bad for the nose. Move to the seaside. Many patients often say they do feel better, and of course that's all the rationale behind us recommending saltwater washes. Sometimes medication can cause rhinitis. Certain hormone treatments, certain antidepressants, and other treatments can cause rhinitis. So it's always good to look at the medical drug history. If you're exposed to certain irritants at work, whether it's extremes of temperature or certain chemicals, this can irritate the nose. Pregnancy can cause rhinitis. Now, options are limited at that point, but it's certainly worth knowing. So if your nose gets blocked with pregnancy, then it may well just be something, unfortunately, you have to put up with. And then the other thing to mention is age-related changes. So that can be hormonal, or it can just be to do with getting older. Older people tend to have noses which are a little drippier, not always blocked, but certainly tend to drip a little more when eating or when going out into the cold. So there's a huge range, and your doctor needs to explore all the possibilities of rhinitis to enable them to give you the best treatment. The common symptoms of rhinitis are nasal blockage and nasal dripping. Blockage can be either both sides, or it can be alternating from side to side. That's very common. There's something called the nasal cycle, which everybody has, whereby one side of the nose swells up, and then 6 or 8 hours later, the other side of the nose swells up. And most of us don't notice that, but if it's exaggerated in rhinitis, then you feel blocked. Um, so, and then the other symptom, as I mentioned, is dripping, and that can either be out of the front of the nose, always needing a tissue, or down the back into the throat. It's sometimes hard to work out if the throat buildup of mucus is from the nose or from acid reflux or from the chest or somewhere else. But those are the common symptoms. Very rarely is pain a symptom. And this is sometimes a conversation I have to have with my patients. If there's an allergy related, then sneezing and itching are other common symptoms. And so again, it's all about teasing out what are the symptoms, and therefore what are the potential causes, and then we look at treatment options. So once you've worked out the potential causes, and often we'll do allergy testing to work out, is there an allergy? then we can decide whether anti-allergy treatment using antihistamines is effective, but also trying to minimize exposure to the allergen. So if it's dust, people can get air purifiers for their bedroom, using hypoallergenic mattress covers and pillows, either removing carpets and curtains or cleaning them as much as possible. And then in the summertime, avoiding pollen is difficult, but we try to minimize exposure. And then the antihistamines can be given either by mouth or as a spray into the nose. And there are now two sprays on the market that are available, which combine a steroid and an antihistamine in the same spray, and these can be very effective. So, so antihistamines is one option. As I mentioned in the past, saltwater washes, very effective for all forms of rhinitis and any kind of nasal problem. And usually you'd start off with one treatment if the symptoms aren't too bad. So that's either saltwater washes, antihistamines, or a nasal steroid, and then you start to combine these things depending on the severity. And the other thing to also mention is nasal decongestants. So these are things that you can buy over the counter, such as Otrivine or Sudafed or ephedrine, and they are very effective at reducing symptoms of rhinitis very quickly. The problem is they only last for a short period of time, and it's harmful to the nose to use them for longer than a week or so. And I have patients who tell me that they've been taking these medications for years, and sometimes they're taking them up to 10 times or more per day. And this is a real problem, and it damages the lining of the nose. And my first job in their treatment is to stop them from using these decongestants, try to find something to help them get off it. It's like any form of addiction. And then slowly we can improve the conditions inside the nose, and then get them feeling better. So decongestants are good, but have to be used very cautiously. So rhinitis can certainly be related to other things. Sinusitis is the most obvious thing, but of course that's in the same part of the body, and sinusitis can irritate the nose itself and cause the rhinitis. Other conditions can cause nasal inflammation. They tend to be rarer conditions which affect other parts of the body. Some of the autoimmune conditions, which are conditions where the body's own immune system is attacking itself. And a well-known version of this is what's called granulomatosis with polyangiitis. But fortunately, that's a rare condition, and there are a few others like that. More commonly, the medications that patients take for various conditions can affect the nose. So it's always worth looking at the timeline of when symptoms started and does it correlate with starting a new medication. And always assessing the patient as a whole. So I always ask patients about are there other medical problems, what treatments they're on, and also their lifestyle in general at the time they're seeing me. Because although things like stress, tiredness, anxiety aren't always the underlying cause, they can certainly add to the symptoms and make the patient feel even worse. So the holistic approach in many aspects of medicine, and definitely in all conditions of the nose, is very important. And bizarrely, even certain headaches and pain in the face, whether it's migraine or other nerve problems, can cause nasal dripping, nasal inflammation. So patients usually think, and many doctors think, that it's the nose which is the problem, which is becoming blocked, and that then has a knock-on effect of causing the pain. But actually, it's the other way around. It's the pain which causes the nasal blockage. And so you have to treat the pain, and that will solve the problem. So it can be quite complicated, but usually with a bit of careful history taking and examination and sometimes some tests, we can get to the bottom of it. So the most natural treatment is salt water. I've mentioned this a lot, but this is great, and it makes patients feel a lot better. And there are various products out there, and I would certainly recommend those. Alongside that, there are various creams and gels which you can buy over the counter. The most simple one is paraffin, so Vaseline, and that can be very soothing to the nose. But there are other oils and gels that you can buy which can further help. And apart from soothing, products like Vaseline also act as a barrier. So certainly, if you have hay fever, if in the hay fever season you coat the inside of your nose with Vaseline, the Vaseline will catch the pollen as it flies into the nose and significantly reduce the irritation. So it's very effective. Apart from that, there are other sort of herbal remedies which I don't know as much about, and certainly there are examples of those in various health food shops and places like that. And it's worth asking someone that works in someone like that for their advice on these sorts of things. But some of them can be effective. And then and other alternative remedies such as acupuncture, cranial osteopathy. I do believe that they have a place. They certainly help with certain pain syndromes within the face. They definitely help in reducing tension and making a patient generally feel better and less anxious. So it's not always easy to explain fully how these things work, but I certainly believe that they have a place.